and welcome to GBMC's Greater Living. I'm Mary Beth Marsden. Thanks so much for being with us today. And today we get to welcome one of our favorite guests who's been with us several times. Dr. Fong Liu is joining us again today. She is an assistant professor at Johns Hopkins School of Medicine and, of course, a physician of Gynecologic Oncology at GBMC. And great to see you again.
Thank you. It's great to be here, Mary Beth.
Okay, you're masking, and why don't you just tell us why, so we'll get that out of the way.
Yeah, I had an exposure at the hospital. I know we're all tired of COVID, but it is still very much part of our lives, unfortunately. And so just for the protection of everyone, I'm staying masked as we do this webinar.
I'm curious, how do you know you had an exposure?
A person who tested positive, yeah. And we're, around all sorts of patients and who are under investigation and all of that stuff.
Yeah, because I mean, like, who aren't you exposed to there, right?
Yeah, no, that is very true. It's so important to stay vigilant. Absolutely.
All right, well, thank you for setting the example for us today. I think that we have talked about this subject before, and every time I bring it up, I think it's amazing how complicated it seems to people, and that the message sometimes is not getting out about HPV. Am I right?
Yeah, it's one of the most common conversations that I have with patients when I see them, in consultation for abnormal Pap smears. It's a common conversation that we have.
Let's just start from the beginning then. What is HPV?
So HPV stands for human papilloma virus, and it is the virus that causes changes in the lower genital tract that is, most commonly precursor to cervical cancer.
It's one of the most common viruses, is it not?
It is. It is. Essentially, anyone who's ever been sexually active has been exposed to HPV at some point in their life.
And then, of course, now we've come up with a vaccine, or doctors have come up and researchers have come up with a vaccine that's been widely used now by young people. But even still, not everyone is finishing up either the dosage or is aware.
Right. So the vaccine actually came out in 2006, and there's we have a long history of it, especially now, of its safety. The recommended age for patients to start getting vaccinated is actually ages 9 to 11, and that's for boys and girls. And it's so important because it speaks to the primary prevention of HPV infection.
And then for a lot of people who say, well, if it's so common and I've likely had it at some point, why should I worry about it? And I sometimes think people don't realize how common still cervical cancer is.
Yeah, so this happened recently for the HPV vaccine. It's called Gardasil 9. It was recently approved for patients who up to age 45 to help with the prevention of HPV-related changes in our bodies. And so I still am encouraging patients to get it all the time.
Okay, so let's just start from the beginning. And let's say we're a young person who is not sexually active. And how can we prevent an infection?
So first and foremost, get vaccinated. Vaccine is on all of our minds given this COVID pandemic, but absolutely get vaccinated. That's your best way of prevention of infection in the future. And HPV is a sexually transmitted infection. And so one of the risk factors is having multiple partners. And so, consistent with the usual safe sex practices that we hear from in our sexual education classes, from our physicians, from other counselors, it's always good to practice safe sex with the use of condoms.
No, I was just going to say, how effective is the vaccine?
It's very effective in preventing these pre-cervical cancer changes to the cervix.
And the vaccine is for young men and women.
That's right.
And why
That's
is
right.
that?
So, because the it's a sexually transmitted infection, and so it is passed through sexual contacts, heterosexual, and homosexual, any kind of sexual contact. And HPV is not just related to lower genital tract, like female genital tract dysplasia. It's also implicated in anal dysplasias, as well as oropharyngeal cancers and dysplasias. So it affects all parts of the body that both men and women have.
We talked about some of the risk factors and who is most at risk. Someone who's had multiple sexual partners who's not been vaccinated. Are there any
Mhm.
other risk factors genetically speaking?
Not really genetically. HPV is, or cervical cancer is not a cancer that we think of is hereditary.
And are we yet seeing numbers when it comes to cervical cancer? Now that this vaccine has been out since 2006, is it too soon still to see how it's affected? You know, cervical cancer is what, the fourth highest cancer diagnosis, I think, something along those lines. When should we start seeing that drop because of the vaccine, do you think?
Well, it's an interesting question, and I think we have not seen the uptake that we want, that we were hoping for with this vaccine, and it's for a number of different reasons. And but it's for that reason that we haven't seen the significant drop that we wish, we could have. Yeah.
What are some of those reasons? You can just name some.
Yeah, I think whenever we're talking about a vaccine or whenever we're talking about issues that are related to sex and safe sex, it's a tough conversation to have. And I have this conversation with my patients from very young women to older women, and it runs the gamut. And I think a lot of the hesitancy, I think, has been, well, I don't want to give my child this vaccine because maybe it could be giving them permission to behave promiscuously in a sexual way, and we just haven't seen that borne out in the literature and in the research. I think it's it's understandable why there's hesitancy, but I think part of the reason why I think it's so important that we do these things to get the word out is really to normalize the conversation about sexual health. It's so important so that these topics don't remain taboo, because I think it's when we don't talk about them openly, where things get hidden and not talked about, and then perhaps a diagnosis is delayed because we have hesitancy about talking about this.
Um, I know from experience that when it comes to the vaccine, pediatricians are really at the first line of defense right now.
Yeah.
Do you hear from them about the difficulties they're facing at convincing the parents of patients to permit this vaccine to go forward?
I haven't had personal conversations with pediatricians about it, but it is reported absolutely. Um, and so it can be a struggle, absolutely.
You talked about at the beginning of our conversation, because you're wearing a mask and you may have had exposure to COVID, that we're all kind of facing this pandemic fatigue, and probably have been for months, if not a
Yeah.
year.
Right.
But and this is another vaccine, the HPV vaccine. And it's so, are you concerned that its messaging will get lost in all the other messaging about the COVID vaccines?
Well, I think it is something that we've struggled with during the pandemic, of just the routine screening that human beings still need to have. We are seeing people not wanting to present for evaluation, getting diagnoses delayed, and so that is part and parcel with just culturally and sociologically what's going on. Um, I think it is an interesting opportunity, though, to readdress kind of um, vaccines in general, and let's have a conversation about it. You know, we've been talking about all the I guess challenges with sometimes getting the COVID vaccine for some folks. And I think this is just another good opportunity for us to bring it out in the open and talk about another vaccine that may have some hesitancy around it.
Yeah, and I know uh, it is a stereotype to say this, but I think some of it's accurate that women, by and large, are kind of the force behind making sure their children get to the pediatrician, get the vaccines they need, get now the COVID vaccines that everybody needs in the family. And then at the same time, they still need to kind of worry about, have they had their Pap smear? Have they had their breast exam? Those things may very well be falling by the wayside too. Can you talk about the importance of a Pap smear? I think we've heard it so long in our lives that we tend to forget that we still need it.
Yeah. No, and it's Pap smears and HPV testing, or which are commonly uh, categorized as cervical cancer screening tests, should start at age 21. And depending on your history of results, that will determine kind of your schedule. So that's something to speak to your doctor about. It is still absolutely so important. I can't stress it enough. To continue to get these screening tests done. Cervical cancer is really unique in that we have a primary preventative measure with the vaccines, and also, a very good screening test with Pap smears and HPV tests.
How important is the screening if you've had the vaccine?
It's still very important. The vaccine, so the most recent version of it protects you against 9 types of HPV. There are hundreds of different types of HPV. And so the Gardasil 9 protects us against 9 of those subtypes that are most commonly implicated in cases of cervical cancer, severe cervical precancer, and also genital warts, which HPV is responsible for.
So the Pap test should happen yearly for most people?
So it's actually the interval has been extended to every 3 years, and every also 5 years is another option. But again, this really depends on your history. And so I would just encourage all of our viewers, all patients out there, to really just talk about your history with your physician.
What happens if your Pap test comes back abnormal?
Yeah. So it generally will require further evaluation. In some cases, it can just be repeated at a later time. But again, that's a nuance that requires a conversation with your physician. But for most women, it means that it's another exam where we look at the cervix under magnification, where we apply just an over-the-counter vinegar solution. It's just like white vinegar that we use. It's not particularly caustic. And what that does is it oftentimes will reveal abnormal areas on the cervix or inside the vagina otherwise, that will require biopsy to further evaluate the cause of the abnormal Pap smear.
And do you have sort of percentages of how many abnormal Pap smears actually turn out to be something cancerous?
Well, it really depends on the type of abnormality of the Pap smear, so it's hard to really answer that. But my encouragement to all of our viewers is just um, don't. It's so normal to be anxious about something like this. Just know that it is something that can be evaluated, and the important thing is to get that evaluation because it can be treated. The most important thing is that it can be treated before it progresses to cervical cancer, and just to see your doctor.
And so I guess when you would have an abnormal Pap smear and then you would test it again and it was not, do you call that a false positive?
So it is, again, it depends on the abnormality. And so oftentimes we are, if you've had an abnormal Pap smear in the past, and down the line it clears up, it is something that can get cleared, that HPV infection can be cleared. And going back to kind of the risk factors, one thing that I didn't mention that I think is important to mention is that patients who are immune compromised are at increased risk for HPV causing these precancerous and cancerous changes to the lower genital tract. Also, smoking. So this is something that's extremely important that so many patients I talk to actually, they know, oh yeah, yada yada, like smoking, lung cancer, I get it. But smoking is a risk factor for developing cervical cancer. So that is a very, very important message that I want to get out there. And so all of that is to say, in terms of clearing this infection, your immune system, things that you could do to bolster your immune system, getting enough sleep, adequate nutrition, lots of antioxidants, and exercise, and avoiding things like, smoking that are detrimental to your health on so many different levels is so important.
How about alcohol?
So alcohol, I think in moderation is absolutely fine. Certainly, it hasn't been as, you know, we don't see the same risk factor for alcohol as we do for cigarette smoking. But of course, alcohol also has other, potential ramifications when taken in excess.
I'm curious, if not cancer, or let's say it turns out to be normal the next time, what else could cause an abnormal test, abnormal Pap?
So, so this is something that can happen. We can see this in women who have undergone menopause. And so, and this has to do, so essentially when there's not very much estrogen that's circulating through our system, the cells of the lower genital tract change in their appearance. And so when we look at them under the microscope, they can sometimes be mistaken for a precancerous abnormality. And so sometimes we will, have patients do a trial of vaginal estrogen just to help to reverse those changes so that a more accurate diagnosis can be made. But that's a very, very specific situation that, again, when it comes to hormones, that's another whole other conversation that I would encourage the viewers to really discuss with their provider.
So much of what we've learned about healthcare over the pandemic is that telehealth has been a wonderful tool. But when you need to get a Pap smear, you have to go to your doctor. And I'm sure for a long time you weren't seeing anyone getting tested. Did you see an influx sort of after the lockdown was lifted, or are you still really just trying to get the word out to people? You've got to start getting your screening again, get back on the schedule, and take care of your health. And it's not all just about the pandemic.
Yeah, no, I think that message needs to be repeated again and again. As a GYN oncologist, we are, in terms of the screening, we don't do as much of the screening. We certainly evaluate patients who have a concern for cancer, or of course are treating patients with cervical cancer. And so I think it's a message that continues, that we need to continue to repeat.
Yeah, do you find too that women of a certain age, I get the sense that when you're a younger woman of childbearing age, and that's important to you, you're taking steps to make sure you're healthy in that respect. But after that period passes, and let's say menopause, you sort of let that go.
Yeah, I think I think that is true. I've heard patients say, "Oh, there's not much going on down there," but it still requires screening and evaluation because sometimes these changes that HPV, for example, causes can be something that's delayed. It takes sometimes years for these changes to occur. And so it's still important to continue to go in to get your Pap tests and also get your mammograms and colonoscopies, all of those things that we should all be doing to take good care of ourselves.
Dr. Liu, for all the years that I've been doing stories about HPV and cervical cancer, for some reason, I feel like HPV has an image problem. People still have a hard time getting their heads around what it is. Breast cancer seems easier to explain and the different aspects of it, but this seems more complicated. Is there anything we can do to get the message out better?
Well, I think it's really just normalizing it. It is so common. It is almost ubiquitous. And this is the conversation that I have with my patients all the time. Like the important thing is that you're coming in and you're getting this evaluated and get the vaccine if it is, especially if you're younger than 45, please, absolutely. I cannot stress this enough. And I think it's a little bit nebulous just because um, it's not a situation that's black and white. And I think that always makes it a little bit more of a challenge to have like a sound bite or a clear cut, oh, this is what you have to do, one and done, and we don't have to talk about it anymore. But I think it actually, if we give it the appropriate time that it deserves, and listen to patients and encourage patients to discuss it, this is how we make change. This is how we change the culture. This is all part of, you know, my one of my missions of, getting women to take good care of themselves, to really prioritize themselves. And I think that's such a great message that you have.
Thank you. On that note, I think we will end it here. And Dr. Fong Liu, thank you so much for talking about cervical cancer screening, how important the HPV vaccine is, how important it is to be screened, get your Pap test, and for women and young men to take care of their health.
Absolutely. Thank you so much, Mary Beth.
Yeah, take care. And thank you for joining us today.